Hi, everybody, and welcome to another Managed Return to Work with Certainty workshop series. I'm your host, Tamara Paris, and we've got a great conversation today with LeBeau, and he's going to talk to us about work environment and exposure assessment. Before we get started, I wanted to let everybody know that we are having our Safety Connect conference, and we're going to have 10 lucky winners for an Oculus Go headset. But you have to register before September the 4th because that's the deadline for the draw. Now, let's bring on Alex. Hi, Alex. How are you today?
I'm well, thank you. How are you?
I'm good. I'm good. I'd like you to kick this off by maybe introducing yourself a bit and what do you do and what you're going to talk to us about today.
Sure. I have a little of this in my presentation. My name is Alex LeBeau. I am a certified industrial hygienist. I am a toxicologist. Today, I'm going to be discussing the indoor work environment and exposure assessment, a lot related to SARS-CoV-2 and COVID-19, but also some general discussions of indoor air quality, environmental quality, and exposure, and how to potentially mitigate some of those issues that you may run into in your facilities.
Thank you. I do want to let the members know that if you have any questions during the session, put them in the chat box, and I'll be sure to ask Alex while we're chatting. Alex, kick it off.
So again, as I said, today is going to be a discussion on the indoor work environment and exposure assessment. As I mentioned, my name is Alex LeBeau. I have a doctorate in toxicology and risk assessment. I have a master's in public health. And as I said, I'm a certified industrial hygienist, a board certification offered by the American Board of Industrial Hygiene. I'm the owner of Exposure Assessment Consulting in Orlando, Florida. So I offer a number of services: toxicology, industrial hygiene, risk assessment, and public health consulting. I've evaluated a number of different exposures, toxicological evaluations of chemicals and biological agents. I've also evaluated the impact on building occupants by performing indoor environmental quality assessments, including bioaerosols, bacteria, mold, and Legionella and Legionnaire's disease. I've served as a subject matter expert and provided consultation on a number of different environmental occupational claims. I've also authored a number of different safety assessments for food products and for pesticide products. We're giving this today in combination or in partnership with the American Industrial Hygiene Association. I am a member of AIHA. I've been a member since I was in graduate school, going on about, I've been a member of them for 15 years now. AIHA is an association for scientists and professionals that are committed to serving and ensuring occupational environmental health and safety in the workplace and the community. AIHA supports members with expertise, networks, lots of networking. There are comprehensive educational programs that I have actually been a part of, giving talks in their national conferences, and other products and services that help maintain the highest professionals and competency standards. If you want to learn any more about AIHA, and I'll get into this a little more for some guidance documents that are available later on, you can go to their website, aiha.org, or contact the membership at infonet@aiha.org. So today's objectives, what I'd like to get across to everyone today, and I want this to be an enjoyable conversation, we'll kind of talk, so feel free to type any questions, and I'll be happy to answer anything I can as we're going along, because there's going to kind of be a mix of scientific information and practical information as we're going through all this today. So the objective is to recognize that there are a variety of indoor work environments. Some people may be used to one particular style of environments, but making sure that you know that there may be others that you have responsibility for. Understand that SARS-CoV-2 diseases, transmission pathways, and what the potential is for aerosol transmission and all that. We'll get into a little science on that. Application of the hierarchy of controls to COVID-19 exposure mitigation, and learning the downstream impacts of hazard mitigation. So if anyone is unfamiliar with how industrial hygienists kind of look at scenarios, exposure scenarios, we look at the decision framework, and it can be applicable to multiple scenarios. What we do as industrial hygienists is we anticipate, we recognize, we evaluate, control, and we confirm. So in the anticipation, we anticipate a potential hazard for something, whether it be a new process or product that we're using in a particular situation, or any particular byproducts that may occur as use of those products. We'll recognize a potential hazard. If we bring it on site, we know that we have to do certain things to recognize that it may be a potential for exposure in the employees. And evaluate, where you need to evaluate the hazard to determine if there actually is a risk associated with it. There may not be a risk. We may not need to mitigate that hazard, but there is a risk. We take it to the next level and we control that risk. And how we control that risk, we use our hierarchy of controls, and we'll get into that in a little while, is making sure that those exposures are reduced to safe levels below any permissible exposure limits or any other occupational levels that may indicate a potential level of harm. And confirmation. The last one is important. You need to confirm that your risk mitigation is effective. Just because you're controlling for it doesn't actually mean that you're actually you're actually controlling for it. You need to go through the steps of confirming that you have actually mitigated that hazard. So we're going to go through a couple of examples of indoor work environments. Some of these you may be familiar with, some of them you may not be familiar with, but I want to have an understanding of, I want people to have an understanding that there's more than just one type of work environment. So this is an indoor facility where people are, it looks like a mostly automated facility, manufacturing facility. There's some people over here on the right that are doing some final packaging, getting ready to ship out the door, it looks like, and there are a few people over here. They're a few feet apart. These young ladies, it look like a little closer than these, but this looks like a large space where there may not be a lot of people. It looks like a lot of automation of one particular product is used up by this automated process. Someone comes in, just puts another one in here. So it looks like this is a scenario that may be easy to control potential exposures just because of the limited number of people and or the processes, the automated processes that are already in place. So this is another example. Looks like an automotive facility. It looks like they're working on some rear ends of some automobiles. Again, each individual has their own workplace. They're working on their own. It looks like there is potential, low potential for exposure just based on the distance between some individuals. It looks like it will probably be easier to control exposures here. Then again, based on just the size of the space and the area that's taken up by the product they're working on. This is something that may be familiar to people. This is a gentleman doing some welding on, it looks like, pipe. He's using local exhaust ventilation. So he's using something that is an engineering control, which we'll get into later, for capturing any potential hazards or within what his process is doing and expelling those hazards either into a collection device or into an area that is not going to be, where no one's going to be exposed to it, just to give him an extra level of protection just based on the hazardous conditions that he may be working in at the time. So these are some of the scenarios that you may be familiar with for working in an environment. But this next one may not be something that you're typically used to. So this is a cell phone manufacturing facility. There are a number of individuals here, and this is a very wide shot. You can see that this is a packed facility. It's a large facility. There's a lot of people that are close together here with just a lot of processes and products going on. So we'll get a different view of another facility like this that's a little bit closer up. So here is another facility. These individuals are standing very close together. There is no opportunity in this scenario, for any social distancing. There's a lot of open space, but it looks like if you're going to do any additional controls in here, there's a lot of retrofitting that may need to go on in this facility. So how do you handle a workplace like this? How do you handle a scenario where people are packed so close together just by the nature of the work? Well, do you say, all right, well, maybe we'll have half of our workforce come in. So if we take out half of those individuals, is this going to be enough distancing? Is this going to be enough protection for making sure that the indoor environment is safe and that exposure is reduced? And I'm talking in general, but we're looking at, COVID-19. Is this enough to prevent potential exposure of another individual? Or do you need to take it to another level? You need to say, okay, we're going to send these people home as well. So we're going to have every other person at every other workbench throughout this facility? Is that going to be enough to manage your risk? And that's an interesting question because it all depends on how specifically for COVID-19, how the disease is actually transmitted. So this may not be a typical plant that you're used to, but it may be an issue where some people may run into it or may have responsibility or facilities that they're responsible for or put under your responsibility that you have to take care of. So what if you get the facility assigned to you that you're not used to and they have this kind of scenario, but you also find out that, in a lot of facilities, whether it's a manufacturing facility or a final facility where you're putting a final product together, you have office space. So what do you do in an office space? So you have this scenario here. This is the open office space that everyone has been going to lately. And how do you manage risks in here? You have individuals that are sitting very close together and apart from each other, face to face. In some instances, depending on what kind of computers you're using, you have a lot of area, a lot of space, air in here. So if you have a facility that you weren't used to, but you had to take care of an office space, well, how do you treat this? How do you clean this? Well, I look at this and say, well, how do I clean an area that has, looks like beer bottles all along the windows? What do I need to do to reduce potential exposure in here? I need to clean things up. I need to take care of what may be extra areas where something may get stuck or may have to clean and disinfect. These are scenarios that you may not be used to, but you may have a facility that is put under your responsibility now that you have to consider how do you mitigate those risks. Here's another indoor work environment, another open office space, a lot of open area in here. Individuals sitting very close together, probably 2 feet apart with all these computers face to face. It looks like a very nice office space, but one thing that's in here that you may not be paying attention to, you see it's nice area outside the window, but when you look more at the space, you say, well, you know what, it looks like these plants are inside. Well, what kind of plants are these? Who approved the plants to be in there? Are there people who may have allergies from exposures? What is in the soil? Are you watering them too much? If you water them too much, will mold grow? With mold growth, will that be taken up by other materials? Will water be impacting the indoor environment and resulting in mold? These are just things you may not be used to, but you need to think about when you're designing an indoor environment. Designers like to have this stuff because it looks nice, but from a practical indoor environmental quality point of view, you need to take in consideration what other potential issues may be generated by what you put in that space.
So Alex, if I
Sure.
could just pipe in and ask a question here. Yes, people do like green in their environments. And so if you were to put some green and some plants, are there things that one should steer away from and more towards another setup type of plants? Because they do help clean the air, is my understanding, or is that inaccurate information?
Plants usually do. I don't think the amount of plants that you can put in an indoor space would contribute to that. And I'll say this, one indoor work environment, it was a healthcare facility we were working in. It was a hospital. But when you walked immediately in there, it was a very green and atrium where trees and all this very nice flowers were going. But when you have people who potentially could be immunocompromised entering those areas, and you have that soil, who knows what's in the soil, what exposures it may have, that's something you want to mitigate. You don't want to have those kind of things because you may not even think about what impact they may have. So, does one outweigh the other? I'd rather have no plants than have exposure to potential issues from someone who may not have the immune system to make up for it. So, I don't want to say have plastic plants in there. Plastic plants have to be cleaned. There's a lot of surface area, dust and other things can gather on those. I'd say if you had to make it very minimum, have a review process. You never know if someone's going to be allergic to something in one of the plants, and it's going to depend on actually where you live too. Some plants in some areas may generate allergens more so than others. So I think there needs to be a review process for that. Moving on from that, this goes into other spaces you may not be used to. So if you have a building or facility that's put under your responsibility and that facility has office space, and maybe they also have customer service areas as well. So they have a call center. How do you handle environmental exposures in this call center? You have people standing very close. You have them maybe 4 feet apart, but this is a huge space. This is a huge area for exposure. How are you managing what people may be exposed to in this space? You know, that's something you definitely have to keep in mind, and how you're going to deal with it from a management aspect for somewhere you may not be used to. This looks like a very nice call center, very nice surfaces, but what if you get to a smaller call center? What if you get to something where you're 2 feet apart? You're literally face to face with the person in front of you, and it's a small space. You know, these are just things you have to consider when you're talking about the indoor work environment and potential exposures. What if you're doing, what if you're doing construction? You have a construction area. We have people doing installing insulation. You have trades roughing in potentially in these areas. How do you mitigate their exposures? You know, do you only have certain trades go in certain areas of the building? Do you make zones for the building? How are you making sure that the indoor work environment is safe for them to get back to work, to get in there and do what they need to do with the minimum amount of potential exposure? And the last scenario I want to show is, what if you are, you know, these are traditional, these are construction, these are potentially office spaces, these are manufacturing facilities or production facilities. What if you have the responsibility of being safety where you have to interact with the public? What if the public has to come into your facility? How do you manage exposure and risk in this kind of scenario? You have to manage the exposure of your employees. But you also have to manage the potential exposure of your customers as well. And there's a lot of people in there. Do you limit how many people come in? Do you limit how many people can stand in the aisle? These are all things you may have to consider when you're looking at indoor environment and wanting to make sure that you're reducing potential exposures. So from these pictures, you can see that the indoor work environment comes in all shapes, sizes, and designs. And it's important to know that there's a different exposure scenario in each. There's not going to be a one-size-fits-all model for these. You need to, you know, take inventory of what your exposures are and what potential issues may occur from the exposure. So what types of people are exposed across these spaces? Well, you have employees. Well, if they're factory workers, so if they're office workers, like we said, with their administrative staff, management staff, or if they're call center staff and customer service. You have contractors. Do you have people coming in doing routine maintenance on machinery? Do you have people coming in doing repairs? What about your janitorial staff? Are those janitorial staff, are they internal employees, or are you contracting it out to external individuals to come in and clean your facilities? And how do you deal with the public? How do you deal with customers that are coming into a facility, and how do you manage in reducing their risk? So for the indoor work environment, for COVID-19, and I'll say this, I'm going to do it because it comes naturally. I'm going to use SARS-CoV-2 and COVID-19 interchangeably. I think you've probably heard this ad nauseum by now, but I just want to make sure we all understand. SARS-CoV-2 is the actual virus, the virus that we're all dealing with. COVID-19 is the disease caused with the virus. I try to be very specific where I can in here, but they'll occasionally be used interchangeably just because of the nature of them. What are the disease transmission routes for COVID-19, and how important, and how are they important to how the facility is designed? That's kind of what we're going to go over today. How are we going to maximize protection of employees, and how do we get people back to work? Because we all want to get back to a normalcy. We want to be where we were a year ago. It was normal. We are going to work just like we would any other day. But how do we get back there? And is there a new normal? And can we get back to almost normal? So that's kind of what we want to look at. So to get back to the almost normal, what are some practical solutions for reopening a facility? Are there some? Because we know retrofitting a facility is labor-intensive, time-consuming, and cost-consuming. You know, are there ways that we can practically address potential exposures in the indoor work environment and get back to work? So these are available. From what I understand, they're available on the Facebook group, and I'm just going to present them here quickly. AIHA has worked on COVID-19 resources. I've been a co-author on some of these, been a reviewer on some others. There's plenty of documents here to give you a lot of information. Personal protective equipment, recovering from building closures, proper use of respirators, and reducing the risk of COVID-19 using engineering controls, which we'll get into a little today. Effective is a state practice of guidance, custodians, cleaning staff, and maintenance staff, whether those be contractors or internal employees, guide to cleaning and disinfection for non-healthcare workplaces, and that's an employer's guide for managers, and workplace cleaning for COVID-19. Now, the important thing to remember is all this is available at backtoworksafely.org. On this site, there's information from experts, and we supply industry-specific guidance for businesses and consumers to safely reopen after COVID-19. So if you don't remember all these or can't find these, as long as you go to backtoworksafely.org, you can find links to those, links to the other documents that AIHA has available for getting back to work. So earlier I mentioned control of workplace hazards. So this is the hierarchy of control. We look at elimination, we look at hazards. Elimination, substitution, engineering controls, administrative controls, and personal protective equipment. So how are these classified and when we're dealing with SARS-CoV-2? Well, the elimination, well, we can't eliminate people. People are the main source for this. So we have eliminated people so far, we kept them home. So, but if you want to get back to work, you can't eliminate people. So what is the next potential way of dealing with exposures in the indoor environment? Well, that's substitution. Well, automation is the way we substitute people. We put in robots or machinery, but that's time consuming, labor intensive, and cost intensive. So is it going to be feasible to actually institute automation in your facilities to get back to work, or are there other solutions that we are going to need to take to get back there? So the next we look at is whether some more practical solutions are some engineering controls, and we'll get into this later. Engineering control is isolating people from the hazard. That's using an example here of ventilation. Ventilation, whether it's local exhaust ventilation or dilution ventilation, can remove a hazard from a potential exposure scenario. What are some administrative controls? It's changing the way people work. Well, that's going to be a management area, social distancing. It's going to be ways that management can address how people work and how they are potentially exposed, and manage where employees are and what employees are doing to make sure that they are not being exposed. And the last is personal protective equipment, and that's dealing with respirators or gloves or anything that will protect an employee from the hazard. And it's important to realize that these go from the most effective down to the least effective. So the most effective is eliminating the hazard, which we've done. We've kept people home. If we can't keep people home and we can't substitute people, what are we going to be able to do next? Well, engineering controls. So a lot of hazards are managed with engineering controls. Next, we look at administrative controls, and the least effective or the last line of defense is using personal protective equipment like respirators. And we'll get into a little bit of that today so you can understand, there are things that can be done across the spectrum. There may be some things that are better to do than others, or in combination with others on this hierarchy of control. So COVID-19 in the indoor work environment. How is the disease transmitted? Well, according to the CDC, it's mainly spread from person to person. And according to their guidance, they say that it is close contact between two people, which is approximately 6 feet. It is transmitted through respiratory droplets generated by the infected individual when they cough, sneeze, or talk. And they say it's respiratory droplets that'll land in the mouth if you're facing an individual who's generating the virus in the respiratory droplets. They generate a droplet that goes from their mouth to your mouth. It'll land in the mouth or nose of a non-infected or nearby individual, or inhalation of these droplets into the lungs. So it's impacting the mucous membranes of the individual, or it's potentially inhalation into the lungs. So what about virus surface transmission? A lot of people were talking about cleaning and getting it from potential surfaces. That's why hand sanitizer has been hard to find for a while. So it may be possible from CDC to touch a surface or object that has a virus, and then touching a mucous membrane. It's not thought to be the main way the virus spreads according to the CDC, but this is the important thing that the CDC says. We're still learning more about how this virus spreads. And that's critical. This is what we think so far. This research will go on for a long time. And there's a lot of research that's being generated right now. When I first started researching this and reading into it, I was looking at news stories and seeing news stories. And a lot of the news stories were getting things incorrect. They were misinterpreting information, or they have to go back and update the story. There was one story in particular where they were talking about a virus on the surface that lasted for a certain number of days, and they actually had to go back and say, well, it wasn't an infectious virus concentration, or we don't know if it was. They just found particles or pieces of the virus. So I always try to go to the primary sources when I can. And a lot of times, even the primary sources, there's a lot of information generated by researchers that are pre-publication views of it. And sometimes when you go back to those pre-publications, they're even revised as well. So there's a lot of information being generated on this, and it will continue to be generated. And it's important to know that we're still learning how it spreads or particulars about the virus. So COVID-19 in an indoor work environment. So for recent lines of evidence are pointing that aerosols can play a part in SARS-CoV-2 transmission. Recently, a letter by 239 scientists across the globe, this is from their study, says demonstrate beyond any reasonable doubt, now I added this emphasis, that viruses are released during exhalation, talking, and coughing. They're released in microdroplets small enough to remain aloft in the air and pose a risk of exposure at distances beyond 1 to 2 meters from the infected individual. So up to 2 meters is approximately 6 feet. So, and this is talking about viruses in general, but later on, they go to show the evidence. It says airborne transmission pathway is the only plausible explanation for SARS-CoV-2 quote unquote super spreader scenarios where crowded conditions were present and where ventilation was inadequate. And one of the examples here, and you may have heard of it, was a super spreader event. It was a choir practice. I forget which state it was in, where they had a number of individuals in there. They were social distancing. They were singing very loud, singing, and using your lungs like that will generate respiratory droplets. They attributed it to inadequate ventilation, just a super spreader event where someone was in there that was generating a lot, and the virus spread to a lot of people. But it's important to remember that, you know, just because the ventilation may be inadequate there, it may be inadequate at a lot of places. You know, this article concluded that there was more than enough evidence, supporting evidence for SARS-CoV-2 airborne transmission, despite the lack of universal acceptance of this exposure pathway. And we'll get into that a little more here. It's important to remember that there are usually 3 categories of people who are, they are either symptomatic, they're showing a fever, they have cough, they have pneumonia, they're shedding the virus in some way. There may be pre-symptomatic people. Some data shows that pre-symptomatic people will generate the virus before they show signs, or before they show a lot of the signs of coming up from exposure. They're asymptomatic individuals. People may not even be sick, but may have COVID-19, and they may be generating as well. Again, there's lots of information out there that we're still learning about how it spreads, but there is data to support the airborne transmission pathway. So I want to get into what aerosols versus droplets are, because it's important for indoor environmental quality or indoor work environment to understand the differences here. So for the transmission of an infectious agent from is typically classified by public health agencies as respiratory droplets, which are greater than 5 micrometers in diameter. And I say diameter, that's aerodynamic diameter, how they perform in the air. Or droplet nuclei, which are less than or equal to 5 micrometers in diameter. It's important to know that, you know, when you're looking at droplet nuclei, you know, these are very small particles, and tuberculosis, or there's some bacteria and diseases that form that are caused by droplet nuclei and inhalation of those particles. They're formed as a result of desiccation when the suspended droplets they're desiccated. So that means that they are dried. As soon as you breathe out these small, very small, tiny aerosolized water-esque droplets, they are desiccated into a particle, just like a particle of dust, but very, very much smaller. It's a process that can occur in less than 1 second. And that occurs, if it occurs that quickly, that means that particle can exist for a long time just based on the aerodynamic properties of that. There are guidance out there, and I say it here, only a healthcare issue. WHO says that airborne transmission of the virus can occur in healthcare settings where specific medical procedures called aerosol generating procedures generate very small droplets called aerosols. Now, I think this is where a lot of people, I don't want to say get confused, but they got mixed up in droplets and aerosols. So I kind of want to go into that area. So what are aerosols? So if we're looking at the traditional industrial hygiene definition of an aerosol, we look at aerosols as a collection of solid or liquid particles dispersed in a gas like air. So we can have the diameter of an aerosol range from nanometers up to 10,000 micrometers or 10 millimeters. We look at aerosols as a group. They can range, like I said, they have that huge range. Respiratory droplets, or respiratory aerosols, as we would call them, they have a typical diameter that's up to 100 micrometers. There are studies that show that you can get over that 100 micrometers depending on what's happening, whether it's a cough or a sneeze, et cetera. But typically when people are generating them, a lot of people put that 100 micrometer threshold on there. Again, they range higher, coughing, sneezing. So we identify aerosols of biological origin as bioaerosols. A lot of times we look at those as something from a bacteria, but an aerosol of biological origin is going to be an aerosol generated from the respiratory action of an individual as well. So we are generating aerosols that are of biological origin. And it's important to remember aerosols versus droplet. You're going to hear them both, or droplets or aerosols. Regardless of the name, they're classified as aerosols under traditional industrial hygiene definition. Now I don't want to say clash, but we have discussions with people that say, well, they're not droplet nuclei, they're just respiratory droplets. And that's why you hear some people in healthcare discuss, oh, well, it is, we have airborne precautions versus droplet precautions. But those droplets or those aerosols can range, have a huge range, and studies have shown that. So that's important. And when you're considering the potential airborne nature of this virus. So let's get into a little bit of aerosols. So this is a lovely picture of an individual sneezing. Aerosols' physical characteristics influence how long they remain suspended in the air. Those characteristics in general are going to depend on their size, their shape, and their density. Larger aerosols will settle more quickly due to gravitation and air currents, whereas smaller aerosols will travel further. So when you're talking about droplets, they say, if you sneeze one out, it's just going to fall a few feet. That's why we have 6 feet. It's going to fall a few feet and fall to the floor. But if you have smaller aerosols, they have the potential of traveling further, and that's going to be illustrated on this next slide. We have this individual that's very close in generating them, and this is talking about droplet transmission from medium or large droplets that are just in this small zone where they're close. Long-range airborne route of these transmitted by aerosols are these very, very small aerosols that can travel further. Also, and this is fomite. Fomite is just a non-porous, surface that may be somewhere that's a countertop or anything. Aerosols may travel through those as well. So we're going to get into a little of cleaning in the indoor environment and why that's important. So it's important to remember if they're larger, they're going to fall, but there's a range when someone sneezes and coughs and talks of these aerosols that could have a potential impact on how this virus is spread, and that's important. That's important when we're dealing with the indoor environment. And one thing I want to point out is, so a lot of these viruses are classified on their infectious dose or infectious concentration. Right now, of course, it's still early. We're in this. It's not after the fact. We haven't had years of research. We're in the moment right now. We don't know the infectious dose of SARS-CoV-2. How much of exposure will result in COVID-19? We're still determining that. The World Health Organization acknowledges that there's a possibility of aerosol transmission in non-healthcare settings. Again, as we talked about earlier in those super spreader events, it's for crowded indoor spaces. So those areas where they're manufacturing or doing a final production on cell phones are not going to work because they're crowded indoor spaces. Ventilation was inadequate. You saw it was a large, very large facility. We don't know what the ventilation was like in there. It was probably a very low flow of air in that area. And this is an important one here. It says, much more research is needed given the possible implications of such a route of transmission. So you have individuals that could be having this route of exposure, but no one wants to make that call because of the implication, because if it is spread by this route, then a lot of the information that we may be doing now may need to be changed and upgraded. So that's why dealing with the indoor environment and exposure assessment, this is important to keep up on the anticipation, like I said, of what IH does, and recognition that this could be a route of exposure and that we may need to reduce exposure via this route, because it could be a way that people are becoming infected. And I like to point this out. This is from CDC on information on tuberculosis. Tuberculosis has been around for a long time, and in their guidance on tuberculosis, it says information on transmission of M. tuberculosis is also incomplete. Neither the smallest infectious dose nor the highest level of exposure to M. tuberculosis at which transmission will not occur has been defined conclusively. So even for tuberculosis, there are not defined boundaries on some of this information. That's important to remember. We may not get to that point with SARS-CoV-2, or we may not get there for years. So that's why it's important to look at the hierarchy controls in the workplace and evaluate those hazards. So I'm presenting some information here on the controlling workplace hazards based on the hierarchy controls. So we're going to look at this from the least effective to the most effective. So the first that we're going to come to is PPE, then we're going to address administrative controls, and last we're going to look at engineering controls. So what are some personal protective equipment? One thing about PPE is it relies on user compliance. The question here is source control versus protecting the individual. Personal protective equipment is to protect the individual. That is its purpose, is to protect them from exposure to something. And again, it does rely on user compliance to ensure that that protection is adequate. Shortages in PPE have resulted in novel methods for presenting exposures from infected individuals, and we'll get into that a little later because the discussion of masks, because under the definition, masks are source control versus personal protective equipment is protecting the individual. It also deals with new or inconsistent definition or disinfection methods for use of PPE. How effective are the methods, and are they safe for individuals after rewear a mask? PPE is important. I'll just get into it. I'm sure a lot of people know what PPE is. Again, it protects the user. When I'm talking PPE, a lot of it's respirators, whereas N95 or P100, half-face masks or full face. A lot of people are using eye protection. I just read something last night that says it's highly possible that the virus can be transmitted with droplet contact or aerosol contact with the eyes, but that hasn't been shown yet. Face shields, gloves, and aprons and gowns. And what's important to remember is personal protective equipment is designed, or respirators are designed to work in a certain way. They're engineered, designed to work in a way that's going to protect the individual. And again, it's going to require compliance. If you have an individual that's wearing an N95 mask that is engineered to have a certain fit, their regulations and rules that say you can't have facial hair. I couldn't effectively wear an N95 mask right now because I have a beard and expect to have that level of protection that the mask is designed for, because I'm not using it in a consistent manner. Or it will be people who take masks, and we'll talk about this in face shield as well, putting them down around their chin. If you're going to use personal protective equipment, it has to be used according to how it's designed, according to how you have your hazard plan or safety plans at work, because if you're not using them the way that they are designed, then the protection is not going to be effective. And I think that's important, like gloves as well. People are wearing gloves, they're touching multiple surfaces. All they're doing from those surfaces is transmitting one potential issue or one potential contaminant from one surface to the other surface. That glove may be protecting them for a certain amount of time, but all they're actually doing, and they have studies and people have done this, is they put some UV type material on the surface and they touch that surface, and then they go touch other things, and they turn on the UV light. The whole area is glowing because all they did was transmit the contaminant from one area to another. So when you see people using gloves for multiple things, you have to reconsider if that's an effective way of reducing exposure, or are there other ways. And again, when I talk about personal protective equipment and the hierarchy controls, it's the least effective because it's going to rely on the user compliance, and users will get to a point where they're tired of wearing the mask or tired of wearing gloves, and it will just impact them. And not only that, personal protective equipment, people are going to use that equipment. They're going to act differently when they're wearing that. Now, there have been studies that have shown it, and people have seen it in real world scenarios. You know, if you're wearing a respirator, you may do things that are, you may act in a certain way you not normally would, thinking that respirator is going to protect you. So people are going to act differently when they wear PPE, thinking that it's going to, they don't need to do any of the other things they normally would because that PPE is going to protect them. So that's something to keep in mind, is this is the least effective, and there are other things that we can do to protect individuals along with the use of personal protective equipment. And one thing I want to get in here is, especially for, I'm mentioning masks, but they're calling it PPE. They're novel methods for preventing the spread. And there's a lot of people that have, in the beginning, were using novel materials for masks. And one thing that's important, and I may mention this later on as well, is risk communication. There's a lot of this has been a failure in risk communication and understanding what the risks are from exposure and what people are doing to protect themselves. And the effectiveness of PPE and the limitations need to be communicated to the end user. So these are two stories, two headlines that I came across when I was looking at PPE. And this one says, nurse in Texas developed mask with better filtration than N95. This other story is an innovative mask using this material. It blocks out 99% of particulates. It makes the mask about 4% more effective at blocking particles than an N95. According to this professor who made the calculation based on manufacturer's specifications. And when I looked at some of these, they looked like coffee filters with rubber bands on them. Respirators are designed and engineered in a certain way to fit a certain way. They have to have a fit test, and they are given a sign protection factor based on that. Just because a material is as effective as the material made that N95s are made with doesn't mean it's going to be as effective as those. And people need to understand that, because if they're getting a material that is not fitting their face correctly, that has a lot of leaking seals all around here where air can get into their face, they may be putting themselves at a higher risk, because again, people are going to act differently, especially if you tell them that they are 4% more effective at blocking particles than the N95. They're going to go, well, I'm way more protected. I can maybe do a lax procedure on this because this mask is making me so. So it's important to understand the risk communication when giving people personal protective equipment. So what are some administrative controls? The one that's a step above PPE on the hierarchy controls. There are actions taken by management to reduce potential exposures. What are some ways that we can do that as far as a management aspect? Well, that can be alternating shift work, performing only certain tasks during a shift to reduce potential for contact. It could be, you know, if we do this one task, if we normally have people doing multiple tasks at one time, we do this only during one shift, and second shift comes in and does the second portion of it. What about dedicated assignments? You can assign equipment to an individual or assign an area. You know, if you have multiple people working on a production facility and they're working on, multiple people are on a board, only have one individual on that board. Only have one individual in a certain area and say, that's your designated zone. Don't step outside of that zone because this is your area. That's an administrative control we can do with people. What about operational flow? I've seen this actually in this local supermarket. They have one-way aisles. It's a very good way of saying, okay, we're going to have things one way, but it relies on two things. It relies on the employees doing things correctly, and it relies on customers. So that's the public. Those are people outside of your controls. I've seen people multiple times going the opposite way down those aisles. Well, that's not an effective administrative control all the time, because you have people disobeying what the controls are saying. I've seen employees go the wrong way down those aisles as well. So now you have the public and the employees doing things that are against what your administrative controls have outlined. And you have employees showing the public that, oh, you know what, it's probably not as important to do because the employees are doing it. Why am I going to listen to it? So that's something you got to keep in mind when you're talking about reducing potential exposure in the environment, is you have to make sure that your employees understand and comply with them, because if they don't understand and they're just doing whatever, and then the other people see it, then you just lose that administrative control. Another one is how people interact with the work environment. An example, and a lot of people have taken out use of hand dryers in bathrooms. You know, are there things that we can do to reduce exposure in that environment that can that can minimize exposure. Just small little things. Again, instead of having hand dryers in the bathrooms, put paper towels out. You know, there's small little things you may be able to do in a number of different scenarios that could apply, that could aid in reducing the overall exposure in your facility. So we'll get into this area of face covering, and I'll say this is not a debate on efficacy, but I want to point out that there are lots of different options out there with lots of different filtering efficiencies. So I view face covering as an administrative control. Is it a source control? You're not protecting someone else. That you're not protecting the individual that's wearing it. You're protecting someone else from potential exposure. They serve as source control. They're controlling aerosols from an infected or potentially infected individual, and they're not a means of personal protection. And again, a lot of people don't understand that. You'll be in a supermarket and people walk up very close wearing these masks, and they will reach right in front of you, thinking that mask is protecting you and them. But they don't understand that there's so much leakage that may go on around the sides. Again, those are not form-fitting masks. They have lots of leakage, especially if people don't put them down around the bridge of their nose, or if they wear them down below their nose, or if they have ever put them down here on their face and put them up. There's lots of potential for exposure. So what are these different kinds of face coverings? Surgical masks. Surgical masks can be made of cloth material. They can be made of multiple layers of paper-like material. They're cloth masks, and there's a lot of different cloth masks. You've probably seen them. There's one layer, there's two layer, there's cotton material, there's polypropylene, there's pleated, and there's unpleated. So how do you make a determination on what the actual best one is to use, or do you just let people wear whatever and you know the limitations of it? What about bandanas? Bandanas are interesting, and I'll say this as well, and gator neck coverings. Have you ever seen one? I've got one here. It's termed a gator scarf. These are things that fit around the neck and you can pull them up there. Bandanas and these gator neck coverings are not very effective. And there have been studies that, and I want to say that there have been studies recently, but there's studies 10, 15 years ago that showed bandanas are not very effective at source control, that a lot of aerosols or a lot of particulates get through them. And actually, a recent study did an evaluation of a number of different masks, and it said neck gaiters, just based on the material that they're made of and how they fit, they actually generated more aerosols than an individual did just breathing on their own, because the material split the particles into smaller pieces. So you could potentially be creating more aerosols wearing a neck gaiter than you normally would just breathing alone. So that's an important fact to keep in mind when you're looking at potential source control of employees wearing at your facility. So it may be a good idea to say, listen, if you're entering the facility, I'd really like you to wear this, you know, this N95 mask or something else, and have a standard way of protecting the employee and the environment that you can apply to all of them, and not just rely on what they may have found on, I've seen them on Facebook, I've seen them on Etsy, they're everywhere, and you don't know the efficacy of them all. So if you can do some standardization within your facility, that's a way to reduce potential exposure for your other employees.
So Alex, we did have a few questions, and we're coming up to 10-2. I wanted to bring Dan on, and he had a few questions for you. Dan?
Hear me?
Yes, we can hear you. Go ahead, Dan.
Yes, and thanks, Alex. I really appreciate it. In fact, what you just covered now probably addresses my question as a whole on these coverings versus the mask slash PPE. In a non-healthcare environment, so outside of healthcare, is it true that the mask worn properly is to provide protection to the person around the wearer from releasing aerosols into that airspace? It is not basically typical PPE in that it is not the wearer that is protected necessarily. I think you kind of answered that definitely when you covered the administrative controls on face coverings versus PPE.
Yes, no, I agree. If you're wearing a mask, the intent is to protect those around you. If you're wearing a respirator, you're protecting yourself. And I didn't even get into this, and it brings up an interesting point. There are N95 masks or P100s that have exhalation valves on them. And there are some municipalities that said, well, you know what, you can't wear those because even though you're protecting yourself, that exhalation valve allows a lot of air out, and you are potentially impacting the outside air because that exhalation valve is not capturing any of the aerosols that you're generating. So that's something to keep in mind, that even though you may be using an N95, if it has an exhalation valve, you are not, you're protecting yourself, but you could potentially be contributing to aerosols to the environment where someone may not be wearing an effective face covering and could potentially expose them.
Excellent point. Thank you very much.
Sure.
And so you also wanted to know if he had a checklist. Was that right?
Yeah, earlier on you referenced basically, you know, doing an exposure assessment, sort of one of your first stages of dealing with the workplace. And I know there are very many different types of workplaces. Are there some sample checklists available for the layperson to be able to access and use to help them do an initial assessment of their workplace?
There are very basic ones, and I can identify them if that's something we can add to our list of references already. We can do that. I want to say some of those guidelines that I referenced at backtoworksafely.org for the specific industries they aren't checklists, but they're kind of guidance. They go through some bullet points. There are some generic ones that I can look at getting over there and saying this is just the basics of what you need to do, and if you need the next steps, this is where you need to go.
Awesome. And then one last question is probably one I'm sure many people are interested in. Alex, will your slide deck be made available to the participants?
That is an excellent question. I don't know. I know this is being recorded. I don't know about the slide deck, so I'll defer on that.
So you'll get back to me, Alex, and let me know if we can put that up?
Yes.
Okay.
I'll get back to you. I'll check and see.
And we'll be putting all the resources that we can, as well as the recording, on the Safety Movement Maker Facebook group under the area called Units. And so we have the workshop series from the last time in there, and then Alex and everybody else that'll be in this series 2 in there also.
Is that it for questions?
No, actually, I had another question. So you were talking about COVID and SARS, and can you kind of dig a little bit deeper into that? Because initially, when this all started, I was told that COVID and SARS is not the same thing. That we couldn't look at what was happening with SARS as an example of how to prepare ourselves. And so, am I understanding something a little different here?
Yeah, so sure, I'll take that step back. So this is so I didn't include this, but I could have. I'll go into the details. So the original SARS was just called SARS, sudden acute respiratory syndrome. Now we call it SARS-CoV-1. That was the respiratory syndrome in around 2004. It was in certain areas in Asia and a little bit in the Middle East. And I think it made it here just a little bit, but it was not very deadly. We understood a little bit about it. So that was SARS-CoV-1. The second one that we came to is MERS, Middle Eastern Respiratory Syndrome, MERS. That was a very similar type virus to this, but again, it was very much in the Middle East and didn't really make it out of there and kind of petered out around, I think, 2006. It didn't exist very long. So now we have SARS-CoV-2, CoV for coronavirus. That's what CoV means. So this is CoV-2. It's the second coronavirus that we've identified that causes the sudden acute respiratory syndrome. So SARS-CoV-2 is the actual virus that we're dealing with. And the reason why they call it COVID-19 is the coronavirus. It's corona, it's the virus, and it was identified in 2019. So COVID-19 is the disease caused by SARS-CoV-2.
Oh, and so the second half of that question is, as a responsibility of a health and safety professional, we do emergency planning and look at what type of potential risk could be coming at us. Not just reactive, as in the here and now, but also doing some predictions. Can you share with people how is there a way that we could be more prepared for future potential pandemics or health concerns that could be impacting community and workplaces?
Yeah, I cover this a little later, but there is, It's important, again, from the IH standpoint, is to anticipate and recognize potential hazards. If you're making let's just say you're making a response plan or a health and safety plan or emergency response plan, if you tailor it to COVID-19, you're going to be sorely limited in 5 to 10 years. You need to have a comprehensive plan that could cover a number of things. And like you were mentioning, we did learn some stuff with SARS-CoV-1 that can be applicable here, but this is a different beast. So we may have been able to, if we use that information, say, okay, this is what we need to do. We could use some of that information that we gain from that to do that emergency planning. But we have to always recognize that if we're doing emergency planning, A, it needs to be a comprehensive plan. It needs to deal with a lot of different scenarios. And B, it needs to know that that document needs to be updated continually if new information is gained. If we were talking about CoV-2, it's acting in a different way than CoV-1 did. So then we have to do things differently in our plan. We have to update our plan accordingly. But you can't have something that's just for one particular virus that, this is the end all be all. What if 5 to 10 years from now, we come across something that acts completely differently than this? That if you try to use the same exposure mitigation processes will not apply to that. So they need to be general in a certain sense, but can be quickly tailored specifically for a particular pathogen or contaminant that you may encounter at your facility, because limiting it just to 1 or 2 is not going to benefit you at all. It needs to be a comprehensive, well-written, understood plan that can be easily implemented for a number of different potential exposures.
Great. And do you provide training for that, Alex?
Yeah, I do provide training for how to go through like I said, exposure assessment, a hazard assessment, and then offering potential risk mitigation strategies for dealing with those potential issues that you may come across at different facilities. And again, because facilities are all different, they need to be tailored for those facilities or any facilities that are underneath your control. Especially if it's a facility that you may not be as familiar with. If you're very familiar with a production facility, but you have no idea how to do stuff in an office space, that may take a different set of skills that you may need to get some different advice on. The next step is administrative controls is cleaning and disinfection. It says there's the idea that SARS-CoV-2 may remain viable on surface deposits from infected individuals. There's the thought that, well, it's not a main contributory pathway, or it may not be a real concern, but I haven't really seen any data to show that it does not occur. So because of that, there's a lot of cleaning going on, a lot of misunderstanding potentially of this. There's some people who, if they have a positive, their facility, do a deep clean, and that's the last thing they do. But where you need to realize that you need actual cleaning and disinfecting protocol established. That means that you need to perform a facility assessment and identify high touch areas. You need to say, this is a regular cleaning that we're going to do, and we're going to clean, weekly on these areas, daily on these, and potentially if you have high touch areas, you're going to do hourly cleaning or twice a day cleaning on those high touch areas. You need to understand in that cleaning and disinfecting protocol if you're going to do internal people versus outsourced. Are you going to use your own janitorial staff, or are you going to outsource someone? If you're going to outsource, you need to have some third-party verification of their processes and procedures. You need to understand them and be able to change them on the fly if you need to. If you're doing internal, maybe good to have a third-party verification of your internal cleaning procedures to make sure you're capturing everything that you need. When to clean and sanitize. Again, schedule based on high-risk areas. And again, I mentioned the report of an infected individual at a facility. But again, it needs to be more of a scheduled protocol type cleaning. Healthcare has done this for a long time. They have certain areas that are clean on the schedule, but we're getting into an area where we need to have this in other types of non-healthcare facilities, whether it's an office space or a production facility. We need to be cleaning this on a regular kind of schedule. How to clean and disinfect and what products to use. You can go to the EPA List N that is available out there. Those products that are listed on List N will discuss are rated for being effective against for COVID-19 or SARS-CoV-2. How to apply and disinfect. There are approved methods for when you're registering a pesticide, you have to do it for a certain kind of application method. And some people are using some of these disinfectants for using them in unapproved methods. They're using them on things that have not been evaluated. The safety has not been evaluated by EPA. One thing you also need to do is have some training. We have a guidance document on what people need to do for custodial staff. Again, if they're internal, they need to be applying per the label, and the applicator needs to understand what they're doing and why they're applying it. External, as I mentioned before, potential for oversight. How do we establish that cleaning was effective? Well, we need to develop a testing hypothesis if we want to do verification. Are we performing surface testing? Is it necessary to perform surface testing? That's per the facility. You know, some people, there are tests out there that will test for SARS-CoV-2 on the surface. Why are we doing that testing? What is it going to answer for us? That's going to be a direct measurement of those surfaces. What does it mean? You need to make sure you understand the results before collecting samples for analysis. Are you going to perform other tests alongside those? What about using surrogates? You can use, as I mentioned earlier, UV tracers or ATP activity on a surface to show whether or not the surfaces were cleaned appropriately. Another one is social distancing. CDC recommends approximately 6 feet between people. Well, that's based on direct transmission. Is that going to be feasible in all environments? And what if the distance needs to be further? If it's an aerosol/airborne, 6 feet may not be sufficient. There are studies that have identified aerosols in the actual healthcare settings that have traveled up to 12 feet away. You know, if 6 feet's not enough, is it going to be feasible to do more than that? That's something you need to keep in mind. Can you accommodate that? And what other options are there beyond administrative controls? The most effective of ours is engineering controls, and that places the higher level burden on the facility. It takes the individual out of the compliance equation and places the reliance on existing systems for control. You can use, and one thing to keep in mind is you can use a combination of engineering, administrative, and PPE to maximize your risk mitigation. It can give a better relative risk reduction depending on the scenario than using any one of those individually themselves. However, there are additional costs potentially for the building owners and operators, and that needs to be taken into consideration. There are practical methods, but you need to weigh those methods and costs with the risk of non-compliance, like I said, for PPE. What are some examples of engineering controls? Physical barriers like plastic guards between individuals, and you've probably seen those in stores that you've gone into. Automation or in interactive processes. What about sensors on automatic doors? Ventilation, local exhaust, dilution, or using filtration or inactivation devices like UVGI, ultraviolet germicidal irradiation. What physical barriers can separate individuals during a task? And this is actually from a CDC document. This is a meat production facility. It has a partition here. One of the interesting things, though, if you've gone in any of these facilities, you see these people have masks on, probably face shields, is these partitions make communications difficult. I've been in a number of facilities where I can't understand the person behind the shield because the barrier was so high that they would take their mask off and then lean in and talk louder. So you have to weigh using some kind of physical barrier like this with the protection that your mask provides. If people can't understand you or you're having to readjust while you're wearing that mask, the physical barrier may not be effective. What about automatic sensors? It can remove the need to touch handles if you identify door handles as your high touch areas and they need to be cleaned often. What about you putting in these automatic sensors to reduce these contact points? Automatic sinks, however, those are a possibility, but I'll mention later that those can be problematic just because of other issues that they can generate. What about the implementation of these automatic sensors? It can be costly, it can be time consuming to get these done. What about using ventilation as a control? It can be ineffective if the virus is aerosolized like we think. This is from ASHRAE, the American Society for Heating, Refrigeration, and Air Conditioning, on their, it should say 2020 position paper. Following HVAC strategies have the potential to reduce the risk of infectious aerosol dissemination. It talks about room pressurization, ventilation, capture ventilation, and filtration. So ASHRAE recognizes that you can use HVAC systems to reduce infectious aerosol dissemination. One thing to look at is local exhaust. A lot of people may have seen this. Focuses on an individual task to control exposure, and I showed this picture earlier. LEV may have limited application due to the design of the system and reorientation of personnel. You may have to move people around based on if you already have fixed local exhaust systems in there that may not be conducive to workflow. What about dilution ventilation? It's using clean, quote unquote, clean air to dilute an indoor environment. You're lowering the exposure through dilution of the indoor contaminant by using either outside air, you have some makeup air that's going on, you could be increasing air exchanges in an occupied space. That's what they do in healthcare, and filtration is another thing they do in healthcare. So one solution is using outdoor air. Some people suggest using 100% outdoor air for dilution. So you can do that by opening windows. You can do that by opening outdoor air dampers on HVAC systems, but there are issues with that. If you're in a high humidity area, like I am in Florida, you may not be able to get the system down, or it may continually operate and may not get to where it is efficient. You may be introducing humidity into the system. You may be introducing humidity into your plant, which may cause mold and moisture issues. You may be overworking your system. And if it's an old system, it may wear out a little faster than it normally would, trying to get that efficiency higher. What about outdoor air quality? There's a lot of fires going on in California. People can't open their windows or use outside air dampers just based on the air quality. What about increasing room air exchanges to reduce exposure? This is a viable way. It uses enhanced filtration in existing HVAC systems. You can use a HEPA filter, which is going to capture a lot of the airborne particles. You can also use what's called MERV, minimum efficiency rating value 13 filters. Using HEPA filters is a good idea, but that's just one part of the equation. Using MERV 13 filters, a minimum MERV 13. A lot of these filters require additional airflows in systems, and if your systems aren't capable of getting up there, then they may not be reaching the efficiency that the filter was actually designed for. What about increasing room air exchanges to reduce exposure? A lot of people are recommending using portable HEPA filtration devices in space to aid in achieving additional air exchanges per hour. A lot of these devices are called air scrubbers or negative air machines. And the target in healthcare is to get at least 6 air exchanges per hour to have an impact in an occupied space. And we're kind of, in our engineering control document, we're kind of recommending that. This is a figure from our AIHA guidance for reducing risk using engineering controls. This gives an idea. If you're trying to reach 6 air exchanges per hour in this 1,000 cubic foot room, you can, if you're introducing outside air, that may contribute 1 air exchange per hour. If you have a number of HEPA filtering devices, or if you have, then if you're doing them, they can supply an additional 1 air exchange per hour. And what you're doing is you're having 6 times the volume of the air in the room cleaned, quote unquote, each hour by diluting it and coming through infiltration. So that's just a potential way of reducing potential aerosols that are generated by people in the space. This is a chart, and that engineering controls guidance document on relative risk reduction. If you're using an N95 respirator, that's giving you a relative risk reduction of 90%. The N95 has an assigned protection factor of 10. That means it's going to reduce an exposure to anything, reduce exposure of what it's intended to do by 90%. So if you want to use air exchangers, have efficient air control, if you want to get to a 90% reduction, is the same thing we'd use by using an N95 respirator. You'd have to have 6 air exchanges per hour. That'll give you greater than 90%. If you can't get to that 6 air exchanges an hour, it may not be viable for you to abandon the PPE that you're wearing. And this just kind of gives a relative risk reduction of face coverings, and face coverings for COVID positive people only, saying that if they're using face protection or just masks in the facility, you may only getting a 5 to 10% relative risk reduction. So that's something to keep in mind. And again, this chart's available in our guidance document on engineering controls. Ultraviolet germicidal radiation, it may reduce infection of airborne infectious agents via deactivation. It has been shown to do that in certain scenarios. Installation and use may require modification. This is a ceiling mounted unit. It may require a redesign or an application in certain scenarios, whether it's a office space. Are you able to get enough of these in a larger area that will be beneficial? That's something you have to keep and consider. Are there other methods that are out there? other inactivation air cleaners. And these are some of the dangers that I am coming across lately of potential problems. There are some air cleaners out there that are quote unquote plasma air cleaners. They introduce some kind of plasma into the air, but they could be introducing others. EPA has found that they will introduce ozone, reactive oxygen species, and even potentially hydrogen peroxide into the air. So that's something you have to keep in mind when you're using these non-traditional systems. What are the exposures downstream? If you're making a change now, what is that change going to do to your potential exposures? If you're mitigating one exposure, are you creating another potential hazard by what you're doing to mitigate that original hazard? Vaporized hydrogen peroxide. I've seen a lot of this lately. Vaporized hydrogen peroxide or VHP systems have specific use conditions. They require very specific things. Airtight systems or areas, limits to re-entry. I see lots of people selling these systems using vaporized hydrogen peroxides, and their system will call for nobody entering in 30 minutes, sealing off all the stuff. But then I see pictures of people implementing these systems, and they're just putting vaporized hydrogen peroxide in hallways, or they're just doing it in a gymnasium that's not sealed off. They're not doing things appropriately. So that's something to keep in mind. If you're doing things like this, there are very specific protocols that have to be followed to make sure that people are safe. Because if you're introducing a potential hazard into an area and you're not making people aware of that hazard, you're not monitoring to make sure that they're below any thresholds of concern, then you could be, it's training out one hazard for another. Another is use of ozone generators, and ozone is a highly irritating substance. So using those, especially when people are present, is not recommended. Fogging. Fogging requires very specific use conditions. If you're just going out there generally fogging, it's not recommended. You have to follow the label on the material. A lot of people are fogging with disinfectants that are not approved for fogging, not EPA approved for fogging. That's something to keep in mind. If you're having fogging of your system, make sure you're doing it with the appropriate device. Make sure you're using the appropriate an approved disinfectant, and make sure you're doing it in a safe manner, because there's lots of potential for issues. And again, you can go to the guidance documents. We have a workplace cleaning for COVID-19. There are a few others where fogging is discussed. So the last area I'll cover is reoccupying a facility after closure. Indoor environmental quality can be impacted by building changes. That's either a closure or a reduction in operating capacity. Buildings and supportive systems are designed to be used while they're occupied. And if they're not occupied or they're reduced, it changes the balance without accounting for change in impacts in environmental quality. What about HVAC systems? If people turn off HVAC systems or crank them up because nobody's in the building, you could be looking at high humidity conditions, which could result in mold and moisture damage and mold as a result of that moisture. What about changes in facility water quality? If you have a huge facility that's using hundreds and thousands of gallons of water a day, that goes to using maybe 10 or 20 based on the reduction in capacity, it results in water stagnation. Water stagnation will result in reduction in disinfectants. If those disinfectants are reduced, then it's going to give opportunistic pathogens a chance to grow. And one of those that can result is Legionella within the facility water system. If it is not addressed, it can be allowed to grow and could impact the facility occupants. Legionella is a real concern. I'll get to that here in a second. If you're shutting down water in a facility or you're not using it, that's just giving anything a potential chance to grow. And you can't rely on the public water utility to make sure that you're having disinfectant, because once the consensus standard ASHRAE 188 says once the water is in your facility, it's up to the building owner and operator to manage the risks from exposure to anything in that water. So you need to be taking that in consideration. One thing here is, I'll point out, is Legionnaire's disease. How do you differentiate between COVID-19? Say if you have a number of individuals who are reporting fever and cough and they have pneumonia, do you think, well, most people say, oh, that's got to be COVID-19. We'll say we have COVID-19 people. But some of the signs of Legionnaire's disease are fever, cough, and pneumonia. How are you going to differentiate between the two? Especially, so areas you need to focus on your potable water systems and cooling towers if you have any present. Those are the big ones. And I mentioned earlier about automated sinks. If you have electric eyes and sinks, those are areas that are higher risk for Legionella growth, just based on the solenoid that's in there, the thermal mixing of hot and cold water in those valves. Those are potential issues that you need to be considering. Again, if you're changing it so people aren't touching faucets, you could be creating another issue by saying, I'm trading out COVID-19 hazard for potential Legionella hazard by replacing manual faucets with seeing eye faucets. This is an interesting news story. CDC, who's responsible, put out a lot of guidance for Legionella, has a lot of information on their website. Coronavirus shutdown caused new risks at CDC. Legionnaire's disease, of these closed office buildings that are leased in Atlanta, Legionella was found in their water system. It likely grew because of the prolonged pandemic shutdown. So this is serious to keep in mind. It even happened to CDC. So your facility is probably not out of that risk zone because it happened at the place that actually provides guidance and information on what to do when this occurred, and it still occurred at one of their facilities. So evaluating exposure and conclusions, SARS-CoV-2 and beyond, the indoor work environments. There is no one-size-fits-all model for these scenarios. Each facility needs an assessment performed to adequately control hazards. We need to determine the hazard, evaluate the risk, and control and identify the control methods that are most appropriate for your facility. Getting back to work during COVID-19 will require practical and effective risk mitigation. And I think we can do that by a combination of all of our hierarchy controls, PPE, administrative controls, and engineering controls. A plan to control exposure beyond COVID-19, as we mentioned earlier. What to do in 5 to 10 years from now? How are you going to manage those risks that may occur that are not similar to SARS-CoV-2? How are you going to make sure that you are ready on the fly when a potential hazard occurs at your facility that you need to be ready right away to address? And that's what you can do in an effective indoor environmental quality management plan and emergency management plan. So thank you very much. I appreciate everyone's time today. And if there's anything else, I'll be here. I'm happy to answer questions.
Thank you, Alex. So this was session 1 of our Managed Return to Work with Certainty workshops. So thank you very much, Alex. And this was in partnership with AIHA, right?
That's correct.
And so before we left, I was hoping that you might be able to share a little bit with our audience about AIHA. They're an association for scientists and professionals. Can you talk a little bit more about that?
Sure. As I covered earlier, yeah, we're scientists that evaluate exposure. We come from a number of different backgrounds. We have academia, we have people that are in consulting, we have people that are in industry. We usually get together in annual conferences. Of course, this year's was canceled like everyone else's, where we discuss up and coming topics of concern for the occupational exposure, but we also got to get into a little community exposure as well, because again, there are certain scenarios where we are working with the public, and we are interacting with the public. Those individuals will need to understand what the community impacts of exposure are. Again, all those guidance documents that I mentioned are on backtoworksafely.org. They're great resources to share and use however you need. I think we're still working on some additional ones to get out there so we understand where we can address the potential hazards in this and get everyone back to work. And I left out earlier, but I am the secretary of the Indoor Environmental Quality for AIHA. So I'm participating in these organizations. They're very interactive on what we can do as far as sharing ideas and getting to solutions when we need to in the organization.
Great. And we'd like to thank both you and AIHI for coming and putting on this workshop. This is part of our Safety Connect workshop series, just to promote the conference that we're doing. It's going to be a virtual online conference, Alex, and it's quite cool. We're going to have a VR breakout session, and 10 lucky winners will get Oculus Go headsets. It's going to be a draw. We're going to have it September the 4th. So please, yourself also included, go and register for the Safety Connect. And so that is at industryconnectsafety.com. and I'll put that on the group too and in the email. And so if you register, then you go into a draw, and 10 lucky winners will get a Oculus Go headset and be able to go to this VR session. So that's really quite cool.
Excellent. I will. Thank you.
Yeah. And so again, thank you on behalf of Safepedia for our Safety Connect virtual conference. We really appreciate you coming and joining us today. Thank you.
Yes, thank you. I appreciate everyone's time.